Hi everybody, Jennifer Temel here. I'm one of the PIs of the REACH study. And today we wanted to talk to you about how to handle patients who are in clinic and being approached for multiple studies. A few of our REACH sites have sort of had questions about this, so that we thought it would be helpful to talk to the group about it. First of all, if patients are being approached for a therapeutic study, it's probably not the best day to approach them for a supportive care study, just because therapeutic studies can be really overwhelming for patients and their families. The consent forms are really long. So if you know someone's being approached for a therapeutic study, probably best to approach them for REACH a different day. If they are kind of stuck in clinic though, because they have to have a lot of EKGs and blood draws and they might be bored in between, you can certainly try to catch them, but otherwise I would prioritize therapeutic studies. Some of our sites also have competing supportive care studies, and that does require a little bit more thought. If your site has a competing supportive care study in the thoracic oncology program, probably best for the site PI of REACH and the PI of the supportive care trial to meet and figure out whether the eligibility criteria are entirely overlapping or if there's a way to triage patients to each study. Sometimes for supportive care studies, it's not possible to enroll patients on both studies. We use the term co-enrollment for that. For example, for REACH, because it's a palliative care intervention, it wouldn't make sense to enroll that patient on another palliative care study. And sometimes the outcome measures are overlapping, so you can't have patients on both studies. If you can enroll patients on both studies, it's helpful to sort of stagger it. So for example, here at MGH, we have a competing study in our lung cancer program. That's a study for patients who are having dyspnea. So what we do is we don't approach patients for the dyspnea study until after the eligibility period for REACH has ended. So sort of REACH gets first dibs because patients can go on the dyspnea study at any time from diagnosis. If a patient enrolls in the REACH study, we actually give them a few months before we approach them for the dyspnea study, just so that they're not overwhelmed with surveys. So again, one strategy is to sort of stagger your approaches so that patients enroll in REACH first, and then months later, they're approached for the second study. Sometimes the eligibility criteria are overlapping. So for example, at MGH, we do have a competing palliative care study that we call STEP, and the eligibility criteria are the same. So the way we handle that is we made an internal randomization sheet. So when patients are coming in, they're either randomized to be approached for REACH or approached for the other palliative care study STEP. So for example, if 3 patients are coming in this week, the Monday patient gets randomized, the Tuesday patient gets randomized, and so the patients are distributed between the REACH and the STEP study. So there's a lot of ways to deal with competing studies, and if you contact us and let us know what's going on, we're happy to meet with you. We can even meet with you and the PI of the other supportive care study to try to make a strategy that works for your site. Hopefully this is helpful. Thank you very much.